Here in South Texas, we do have a large population of diabetes. It is something that we face in many patients, high blood pressure and diabetes. Nearly every patient that you click on, it feels that those are your biggest challenges. Some of the patients don't even have hospitals in their town. One town only has one urgent care. Our mission for 2G Consulting is bridging the gap in healthcare to include helping these patients, being able to get their referrals taken care of, being able to get them into the clinics to prevent those unnecessary hospitalization or ER visits. So we definitely service a population of patients that could use that continuation of care. That's one of the things that ThoroughCare can help us do. We first implemented ThoroughCare at the inception of our business in 2021. It gave us the confidence that we could manage patients. So we currently use the CCM application, the PCM application, and we also use the RPM application in ThoroughCare.
Helping our patients manage those two top diagnoses, diabetes and hypertension. For instance, you take a patient that was not on CCM before and their A1C is through the roof, their blood sugars are through the roof, and then you put them on CCM, we're able to establish and create personalized care plans for the patients to what education needs to be provided, what interventions the care managers need to work on, and what goals that we should have for the patients. And as we're going through our monthly calls and our follow-ups, we're going and saying, hey, this is the care plan we created. Are we meeting goals here? Are we not meeting goals? Is the patient meeting goals here? Is the patient not? What does the patient need to work on? What questions do they have? The patient's now understanding, oh, I shouldn't eat this, I should eat that. I should check my blood pressure and my blood sugar every day. I should go for an extra walk. Not to mention we follow up and make sure that they're seeing their doctor, they're taking their meds, their refills are completed, and all that as a whole helps the patient stay healthy and well and prevents the exacerbation of those chronic illnesses.
Also with remote patient monitoring, it's information directly from the patient that they don't have to come into the office, they don't have to come in to see the nurses, and we can address those readings from information they're providing from the home. And of course, that is so convenient for them. In trying to stabilize, especially a hypertensive patient, we need to know now, what is changing your blood pressure readings now?
One RPM patient, she was newer to the program, but her blood pressures were sky high and, they've adjusted meds, but she just needed that extra monitoring. And because of ThoroughCare system, we do get a notification if they check it and it's abnormal outside of the parameters that you set. There was a couple of them that were really high for the patient, and we were able to call the patient, check on her. She had already taken her PRN medication. We contacted the physician, got orders to tell her what to do, and she was able to do that, and the blood pressure did come down, which prevented her from going to the ER, which she had been doing previously before starting RPM.
So one of the things here in Texas is we have Medicare guidelines that we need to follow. There's certain criteria that we have to meet. And one of them also is hospitalizations, ER visits, and healthcare costs. And we have seen a trend that is lowering with patients specifically on the chronic care management program because we're helping to stabilize the patients. We're not allowing their condition to get worse.
We can have the patient reach out to us if they have a change in condition or if they have a medication question, if they have a concern. They can reach out to us, and CCM can then contact their provider's office with the patient's concerns and try to help bridge the gap of they don't necessarily need to come in for an acute appointment today, but is there any order changes you would like for us to do, or what can we advise this patient on to help them with the questions that they have to keep them from going to the ER.
When you set up a program and when you make it as user-friendly as ThoroughCare is, does it then meet the needs of the rural population? Absolutely, because it's front and center of their health care. It's not about just coming to the doctor because they have an acute problem. It's about taking care of the chronic conditions. And now, as chronic care managers, we're teaching them the benefit of going to the doctor regularly, of getting preventative health taken care of regularly. And again, that is something that ThoroughCare helps us with quite a bit.